Hello and welcome. Assalamu alaikum. This would be a talk on professionalism with regards to Umang and how we run the helpline. My name's Navid Iqbal, and I'm one of the co-founders and a director here at Umang. In this talk, we'll hopefully briefly talk about what are some of the values that we need to inculcate in ourselves and किस तरह हमारा mannerism होना चाहिए among the organization and with others, with our clients or people we deal with. Okay, so let's talk a little about what is the goal of our therapy or of any therapist in that matter, and how does professionalism come to play in it. Right off the bat, it says safeguarding the integrity of a counselor and client relationship. We need some rules and regulations, which has ethics, which has professionalism, which has competence. कि हम भी protect that relationship that we're building. We need to remember a very sensitive relationship that we're building, be it of a psychiatrist or a psychologist with your client, where they're opening up, they're sharing something very personal most of the times, and they need to know that this information would be safe. They need to know that this person I can trust and relate to, and that's what builds this therapeutic bond and relationship that we have. Okay, so here we talk about some of the expectations that we have. The expectations that we have from our counselors or therapists are that they need to be calm, kind, knowledgeable, compassionate, and professional in their demeanor. So simple सी चीज़ें हैं. I think people who come into this field are already pretty kind and want to help people, and definitely those who are volunteering with us are already kind enough and care for the cause. So I understand that, but at the same time, we need to make sure that we have the knowledge. Okay, and there's nothing wrong with admitting that I do not know more about this, or I am not comfortable dealing with, let's say, drug abuse or substance abuse because I don't know enough about it. So let me ask someone else to do it. So that's also part of professionalism and knowing your boundaries and not overstepping that. So let's get into some of the details, finer details of what, and this is by no means very comprehensive. These are only some things that I can think of at the moment that would be helpful. So here on this slide, we talk about how the dealings of the organization should be handled. When you're volunteering, we really thank you for giving your time, but at the same time, it is an organization which has rules and regulations. We need to have some documentation. There's some record that we need to keep, and you are in charge of that. You will be given links to the counselor forms, which you can fill from any platform, be it your cell phone, your tablet, or your computer. You just require, it does not take a long time. You're required to fill these for each client, or if there's like an incident report that there is, we really expect that these things are filled promptly and completely. Okay, that is one. Second is following protocols. These videos will give you idea of what to follow and how to deal with patients and clients in certain situations. We should really focus on following those, or following the internationally set guidelines, and not trying something drastic, or putting our own personal preferences or something that we think would work into action. Okay. Then there's also the fact that there's when you communicate with each other or the operators or anyone in the organization, be it via email or via WhatsApp or via phone, and with clients as well, we expect some form of professionalism. It's good to build a bond. It's good to have friends among the organization, people you can work with, people you can refer to, but at the same time, keep it professional. A small example would be, if I am requesting someone to do something, I would just add the word please and start my email with, if I really request that you please complete this task. I don't have to, no one has to, you can just say, do this task, but at the same time, it gives more respect to each other, and that's what we are asking for, respect from everyone. Thirdly, for inner organization stuff, I would say that if you disagree with anything in the organization, do report it to HR. It will be addressed in a rightful manner, and there'll be a process to it. And we value your feedback, we value your opinion, so please do that by emailing HR, and we will talk about it. Similarly, if you see something that's going wrong, or if someone tells you, oh, that counselor said something and it is alarming for you, do email HR, and once again, your information will be kept confidential, and we will look into it, because that's how we will know if someone is not following protocols or if someone is not being as ethical as they should be. Okay, moving along. Now this is, so we've dealt with the part where we're dealing with how to deal inside the organization. Now comes the major chunk of what we're talking about when we're dealing with clients. I'm pretty sure, as all of you are practicing for some time or the other, and you were trained in good schools, you have this education, we all know all the basic ethics of how to deal with a client that comes in. Side note here is that you notice that I'm using the word client rather than patient. It's just something that is more welcomed. When you label someone as a patient, they adapt that role, and it has a negative connotation, especially हमारे culture में बहुत negative लिया जाता है कि मैं मरीज हूँ. That's why I'm calling. So we just use the word client. Gives a better, feel to the whole interaction. Next slide, we talk about maintaining boundaries. So here we are talking about what is the goal of it. There's something that is said, and I'm for a believer of this. It says if you don't set and execute boundaries at the beginning of the counseling, it will feel even harsher to do that after the relationship has been established. So someone calls you and they're not informed of how the helpline works, and they think that you will be their personal therapist for how many times whatsoever they want to call. And if you don't tell them that, no, sorry, we are a helpline, we will talk to you this time, and these are the regulations, we can follow up, set up a follow-up for this many times, and this is how it's going to work. I think it's difficult because people want to talk, and yes, you listen to them initially, but in that first phone call, do make it clear that this is how we work. Otherwise, they would be extremely disappointed when they want to keep on talking to you for repeated calls. Okay, and also explain your role to the patient, because people do not know. Sometimes people think you're a medical doctor. Sometimes people will think that you're their personal psychologist, and they would call you for every reason. Because they have your personal number or your work number, they would expect that it's okay to call. So set those boundaries early on. Tell them that it is not okay to call unless you schedule a time and are talking to them. Okay, and this should be self-explanatory. The third point here is not to have any relationship with anyone, be it as platonic friends or a romantic relationship with anyone, and even in the past or a current client. That is definitely a no-no anywhere in the world. Anyway, second major point I want to talk about in the next slide is to be mindful of the language we use. So something that I practice personally in medicine and how I was taught is when you start the call, you can ask the person how they would like to be addressed. Some people here in Pakistan, लोग अपना first name use करते हैं ज़्यादा बात करने के लिए, be it professional or any setting. So you use your first name. Some people prefer a nickname. Some people might say I do not want to hear my name or to disclose my name. So that's fine. आप उनसे पूछें कि मैं आपको किस तरह बुलाऊं, आपको किस तरह address करूं. And I would say using language like आप instead of तुम is also very helpful in building this professional relationship. Once again, this is the ethics thing. The second point here is not to be judgmental. So your tone has to show. Does not have to show any judgment whatsoever. Let's say someone tells you about their sexual orientation and they say that they are bisexual, and so answer should not be acha. So I mean, you could say acha, TK, but that's like, so you see the difference between the tones. Just make sure that nothing sounds derogatory or judgmental at any time. Usually keeping it monotone throughout with some emotions expressed is the way to go. Then is a point about giving compliments. So now an example would be someone with body dysmorphia calls in, or like body dysmorphic syndrome or someone who is being bullied about being fat and or overweight. Then you look at sometimes people call you to WhatsApp, and you look at their picture on WhatsApp. This would be not advisable at all to be like, oh, nahi maine aapki picture dekhi thi and I think you look fine. Because I mean, this, no matter if you're the same gender, if that's a woman calling a woman, if that's a man calling a man, that is not your place to say or comment and compliment them, or just compliment on their progress. Avoid and do not use any compliments on personal appearance or personal style or anything of that sort. Okay, then lastly, sending a message or signing your emails or anything along those lines. There's an example, and this is an actual example I saw in a paper where someone was signing messages with "Love, your counselor." So this might sound non-threatening or not a big deal, but it can be very tricky, and we need to avoid language like this. Usually some counselors get more friendly with people, and that's fine, as long as you keep it professional. Earlier on, I was talking about using words in Urdu like aap instead of tum. So similarly, using words like, sometimes people would be like, yaar maine to ye kiya tha, but like that's how you would talk to your friends. But that's not how you would want to or should be talking to a client that's calling you. Okay, so avoid and keep a check on what you're saying and how you're delivering that. Next slide talks about social media, and this is a big deal, and I personally have had experienced this, where because you have your number given out or your name on the website or something along those lines, people might be able to find you on social media. People did for me, and they would message me there. So I would have to politely tell them that this is my private account, and I cannot talk to them over there, and I would not advise them to like follow me or to befriend me over there, because that's not your relationship. That's not what you want. Even though you've talked to them a couple of times, I would advise not to have them, irrespective if they're your current clients or if there's someone whose life you even changed or helped change in the past. Do not do that, please. That is a very slippery slope and can cause a lot of trouble. Then we're talking about favors and personal gains. Hopefully we will not have this problem here, but if let's say someone you help someone and they tell you, oh, I run this restaurant down in Defense, and thank you so much, you really helped me. I will SMS this code, and if you want, you can come in and get a discount from our restaurant anytime whatsoever, or a free meal or whatnot. Do not accept it, please. Even if they forcefully send it, ignore it. Do not take it, because we are a free helpline. We do not want to kind of directly or indirectly affect anyone, or benefit from people, because that takes away from your therapeutic relationship. Second thing is that there would be people who would call you and ask you, especially people you've talked to a couple of times, and now you tell them that they need to go see someone in person. And I know a lot of you might have practices of your own, but I would advise that do not refer them to yourselves, because that kind of is if not, I mean, it's not illegal, but at the same time, it's not very ethical. There's a conflict of interest there, where you talk to them on a free helpline and then kind of drag them into your own practice. So I would suggest against it, and I say do not do it. The solution I have for me, or similar applies for, do not refer them to a friend of yours or a colleague, or even if they're asking about a psychiatrist, maybe you know of a great psychiatrist. I would not say that while you're representing Umang, you tell them to go to any particular doctor. The way around it is that you ask them to, you educate them. So people might not know what a therapist is, or a clinical psychologist is, and a psychiatrist is. You tell them about the difference between the two, and then you're like, I think you would benefit from a clinical psychologist. एंड आप जाके ढूंढ सकते हैं, there's a website called marham.pk, आप उस पर जाइए, आप उस पर डालें क्लिनिकल साइकोलॉजिस्ट, आपको सारी लिस्ट आ जाएगी, उसके ऊपर रेटिंग्स भी हैं लोगों की, उसके ऊपर रिव्यूज़ भी हैं लोगों के, आप उसके ऊपर there's also a section which tells you what each person charges. तो instead of embarrassing someone and saying कि oh आप उनके पास चले जाएं, या आप like asking people what you can afford and what you can't, so that's a great resource where they can look for themselves. And also try to explain that the therapy is very individualistic. Someone you think is great might not be a great fit for them. So just encourage people to go on there, look for the therapist, and choose the ones they are comfortable with. Okay? So please, please, please do not ask people to come see you in person and charge them. That should not be happening. Okay? Finally, I talked a little about this earlier, where I said that if you see something wrong happening at any level here at Umang, be it from the higher management, be it a counselor dealing with a client, be it operators, anyone, I really encourage you to write to our HR department, and the link to the email address is given here. I'll also say it out loud. It's hr@umang.com.pk. This will be dealt with confidentiality. You will not have any consequences of telling on people, and I really encourage you, because this is how we will keep a check on everyone and ourselves and build this community. Okay, sorry this took a long time, but these were important things that we needed to talk about. So thank you so much, and if you have any questions regarding any of this, or any other questions regarding professionalism, or you want to discuss any of this, feel free to email me at navid@umang.com.pk. It is NAVID at umang.com.pk, and that's it for me. Thank you.